I mean, I think here's something else. I think we should also just sidetrack a little bit, right? And so we know that we know this project is about beating melanoma. The highest incidence of melanoma skin cancer happens in people with Fitzpatrick type 1 to 3 Caucasian individuals. And one of the questions is perhaps we can delve into a little bit. The risk of skin cancer in Asian, Hispanic, and African Americans much, much lower, right? In fact, you were a part of that working group in AAD that talked about, you don't really think that UV plays a major role for causing skin cancer in people of a skin of color, right? Why should people of a skin color use sunscreen, use photoprotection?
Very, very good questions and very pertinent questions because, nowadays, all of our practices, we do see individuals of different skin types, light skin to very, very dark skin individual. I think the concept of what I call to be personalized photoprotection is becoming an important and very relevant concept. This is very similar to personalized medicine, also known as precision medicine, right? Because they know for certain individual, because of the genetic mutations and all that, to treat their cancer, you go with this particular drug, while for the individual, you treat with other different type of medication. Very similar concept are for photoprotection, specifically for sunscreen, depending on what we call skin phototype, meaning the skin color that you have, that you need to modify the type of sunscreen recommendation that you need to make. I want to emphasize that even for darker skin individual, yes, the risk, as you have mentioned, Steve, the risk of skin cancer is significantly lower compared to fair skin individual, but it's not zero.
Agreed.
We all have seen individuals, Asian, Latinos, as well as Black, who develop skin cancer. A lot of time they call pigmented basal cell, pigmented squamous cell, meaning their pigments in those cells. So the risk is not zero, lower, but not zero. So I think that is an important reason that they also, the darker skin individual should also be using sunscreen. Number two, the pigmentation, the blemishes that one developed. Again, the use of sunscreen, the use of photoprotection would minimize the skin blemishes, the uneven skin tone that darker skin individual would develop. So I think there's another very good reason of practicing photoprotection, of using sunscreen. Having said that, what do I mean by personalized photoprotection? For lighter skin individual, we would recommend to use higher SPF, at least number 30 to number 50. Definitely outdoor, I would recommend usually 50. It has to be broad spectrum because SPF, as we know, it protects, it measures the protections against UVB, which is the burning ray. But having broad spectrum sunscreen, which is important, is that it would mean that the sunscreen would protect against UVB, but also UVA, which is the aging ray, the ray that causes significantly wrinkling of the skin. So for the lighter skin individual, number 30 to number 50, broad spectrum. For darker skin individual, number 30 would be sufficient because the risk of sunburn is not as high, definitely, for darker skin individual. So number 30, in my opinion, should be sufficient. But this group of individuals, because of the pigmentary changes that can occur with them, on them, because of UVA, because of visible light, they need to use a broad spectrum sunscreen. And ideally, they should use also tinted sunscreen because currently tinted sunscreens are the only sunscreen that would protect against visible light, at least in the United States. There are new filters in Europe that, as you well know, Steve, that would protect against visible light, but in the US right now, there is none. So tinted sunscreen is the only sunscreen that would protect against the effect of visible light. So that's what I meant by this, personalized photoprotection from lighter to darker skin individuals.
No, I think we can probably spend another 2-3 hours just talking about this. You know how much we always talk about this.
Yeah.
There's a lot in there, right? And you mentioned something about the damage the visible light can induce in pigmentation, especially in dark individual. And your group pioneered the research.